The best morning news starts now.
Welcome on back. A remarkable rescue, all caught on camera after a worker was stuck on a stadium light pole in Mesa. Crews quickly worked to get him down safely. Joining me this morning, two firefighters on the team, Steve Sauer with the Mesa Fire Medical Department. Good morning to you,
Good
Steve.
morning.
And Joe Contreras Jr. with the Tempe Fire Medical Rescue Department as well. Good morning to you.
Good morning.
Thank you for coming in, gentlemen, and thank you for all you do. Take us, if you can, you both showed up, right? It was a lot of different people there working on this rescue. Joe, we'll start with you. From the very beginning, when you show up, what happens?
When we first arrive on scene, the first in crew, whoever the officer in charge is, they're going to take command. And so with that, I believe a Mesa captain took command of the scene and then started assigning units, kind of making sure that based on the situation, assessing what was going on. So quickly we realized that this was going to be a technical rescue assignment, so we started realizing how many members were coming in.
Yeah.
My crew was the first TRT team to be there, and so right away we got assigned to rescue sector and we started getting all of the first steps in place.
Okay, speaking of those first steps, we're going to take a look at some of the video of that rescue as well. You show up, this man right here, he's trying to change a light bulb right up high, and what happens?
We are not sure exactly how his injuries took place.
Yeah.
All we know is that he had suffered a head injury, and he did not feel comfortable after he received his injury coming down on his own.
Yeah.
Thankfully, he was stable enough to be able to call 911, call for help.
Yeah.
Once we got up to him, we were able to, call him, talk to him, talk about a best plan of how we were going to get him down safely.
Okay, so he was kind of speaking and everything. Steve, you all show up, and what takes place? Everybody's kind of working together. You said you trained together for situations like this.
Yes, ma'am. So across the valley, we're considered a regional technical rescue team, and that consists of water rescues to confined space to rope rescues and mountain rescues. We train every Tuesday as a region, and that way we can all seamlessly fit together on rescue calls like this and try to help out the best way. So like he said, whoever takes rescue is like who's running the call, coming up with plan A through C in case something changes while we're up there. And we all start getting up the gear. We have what we call a fog manual, so there's different types of things we train on, which in this case we specifically train on this type of what we would consider a skate block rescue.
Okay.
To lower them down on that kind of rope system. We've trained on it on lattice works using Chandler Fire Department. They actually have a lattice tower there to work on, so we just converted that into a monopole rescue.
Oh, wow.
Confirmed that was safe through Phoenix and all the other agencies on scene. They're able to make a couple quick calls to engineers and confirm that it's a safe procedure, and we start going up with all of our equipment and go from there.
So we were chatting off break. We estimate maybe that was up 120 to 150 feet or so. Who goes up at that point? Is it somebody on what team? Who goes up to rescue him, and what takes place next?
It's just a determination by the, whoever's assigned to that sector. And so
Yeah.
we were both part of that crew, and our captains decided that, we were both willing and ready to go, and they were decided that we'd be the two to head on up.
Usually it's going to be who's first on scene gets that rescue assignment, and that way we can get someone to the patient as quick as possible and just be able to determine what their medical needs are,
Okay.
and then to help finish the plan. And if everybody on scene's willing to do it and wants to do it, we were the lucky two that day to be chosen to go up top.
How do you get up to him at this point?
We decided that the quickest and safest route was going to be using the ladder truck to get us up as high as we could.
Yeah.
And then once we were at that ladder's max reach, we went ahead and hooked into the tower and started making the rest of the climb up to the patient.
And then you kind of hook him onto what is similar, I think we had described it like a zip line type thing?
Yeah, pretty similar. Yep.
Yeah, and
just
then
a pulley system.
you
Then
pulley
they glide down the rope.
Yeah, why that pulley system as opposed to other ways to bring him down?
There's several choices we can do. We chose that one because of the catchment hazards coming down the monopole, the lattice work up top, the little rails that you climb on, so that hopefully it won't grab him and get a hold of his gear trying to get him down. So it's easier because it's slowly that you come away from the pole as you're descending as well. So it's just a safer approach for him to come down. The people on the ground have set up all the anchors, and they're actually running the system and making it a nice safe descent down.
Oh, we don't have much time. Just one last question. What does he say to you guys when you're up there? What do you say to him? Just checking to see if he's okay, or?
Yeah, we just, try to keep him calm, let him know that we're there to help, and we're going to make sure that we take care of him, let him know that he can trust us, and that
We show him our system a little bit, give him a quick educational component. He gives us a quick educational component to his gear. He's actually in a full harness, so we were able to use his system, make it a quicker to get him down. So we both communicate back and forth, going over all the safety checks so he's confident. And luckily, a gentleman like him, he was confident. He's up there. He was completely comfortable going down that route, so it made it very easy on us. He did a lot of the work. He did a lot of the work.
Can't be afraid of heights on that gig. That's for sure. It's very cool that I think we have Tempe, we have Mesa, and we have, you mentioned Chandler and Phoenix, that all of you work together so seamlessly. So thank you for all you do.
Our pleasure. Thank you.
Thank you. It was remarkable to watch it all unfold. I know you all weren't thinking about all of us watching you at the time, but it was pretty remarkable. So thank you. Thank you. Anita.